Hi friends, if you live in Canada, you need to watch this video, and some of you from other countries might also find this interesting. So my name is Dr. Carter. I'm a physician with specialties in internal medicine and rheumatology, and you may or may not know, but healthcare in this country is truly falling apart, and I feel like it's not getting the attention it deserves. And I am fortunate to have this platform, so I thought I would use it to help spread the word and see if we can gain support, because if things do not change soon, I really fear we're at a breaking point. And now I work in the province of Alberta, so I'm going to speak mainly from my perspective, but I understand that it's even worse in certain provinces and other provinces, so I can't even imagine how bad it is. But I'm just going to give you a few statistics. For example, if you need a hip or knee replacement in Calgary, where I work, the wait to even meet the doctor, just to have the initial consult, is 28 months, and then to have surgery, it's going to be another 6 to 12 months after that. And it keeps getting worse and worse. As a rheumatologist, the wait list in Calgary to see a rheumatologist, we have almost 4,000 people on our wait list. And you'd think that the government would be doing things to try to help physicians and help the healthcare system, but instead they keep making more and more cuts and making it more and more difficult for us healthcare workers. For example, in Alberta, the province where I work, the government has just proposed cuts to our on-call stipends. So they're either drastically reducing the amount of money that we make on call, or just cutting the stipends altogether, expecting doctors to work for free. For example, for our specialty, from the hours of 7 p.m. to 5 a.m. when we're on call, starting April 1st, we will now make $20, period. Not $20 an hour, $20, period. And some specialties won't make any money at all when they're on call. Now, other provinces are actually doing things to increase physician payments, but for some reason, the Alberta government is going the opposite direction and decreasing how much we make. Now, being on call is extremely stressful. When we do it as rheumatologists, we're on call 24/7 for 7 days straight. So it's very exhausting. It's extremely stressful. And then to only be paid $20 to work for 10 hours, it's honestly a joke. So what do we need? We need your help. We need you to write to your government officials, let them know that you support your healthcare workers, because without more attention and more feedback from constituents, nothing is going to change, and the system is just going to keep getting worse and worse and worse. And we're going to keep losing more and more doctors. I have many colleagues who have quit medicine altogether in the last year. For example, one is going back to law school to be a lawyer, and other doctors are leaving for other countries and other provinces where they're getting paid better. So we don't want this to happen. And so if you could please help, we would be so grateful. So please make sure you share this video and lend your support. Thank you, friends.